Well, good morning, everyone. I know you were hoping I would show up wearing my Burmese longi like I did last time, but it's a little cold outside to be wearing a skirt today, so you'll have to excuse me for that. This morning I'd like to talk a little bit about artificial intelligence and machine learning in orthopedics. It's a topic I chose because I'm interested in it. Not that I'm a pro at it. I'm sure there's people in the room here that will know more about it than I do, but I just thought it was an interesting, timely conversation for us to have. We live in an era where things are evolving so rapidly that it's impossible to keep up, and we'll barely scratch the surface of artificial intelligence and machine learning in the 30 minutes we have here this morning. I'd like to begin with a hypothetical thought experiment. Oh my gosh, you're going to sit over there, you can't see. Yeah, here you go. And this is just a thought experiment. The question is, if a fish could describe what it's like to swim in water, what would it say? Any thoughts?
Like it's walking?
Well, I guess you would say that. Yeah, I think it would probably not know how to respond to the question. It's never known any other existence besides being in water. So I don't think it can imagine anything else. And in much the same way, we're now immersed in a technological surge that's dramatically reshaping our world. The thing that's interesting about it is that many of us here have never known anything else. We've never known life without smartphones or the internet, yet in the vast span of human history, the advances that we're seeing in the last 50 years are just an instant and have penetrated human existence so quickly. The skull on the left belonged to Java Man. I don't know if you've heard of him. Evidence suggests that Java Man was the first species to control fire, and that was nearly 1 million years ago. The photo on my right is my my paternal grandparents. It was not until their lifetime that something other than fire was used to illuminate the darkness of night. And you just think about that. From Java Man to my grandparents, fire the whole time. Now let's jump forward. We'll bypass milestones like the development of the transistor, printed circuit boards, and Moore's Law to something even more personal. On the left is a picture of me holding my newborn daughter back in 1991. And on the right is a recent picture of her. She's now in her early 30s, about the age of many of you here in the room. With the release of the Netscape internet browser in 1991, Lisa and the internet, as we know it, were born the same year. Cell phones weren't around then either. Smartphones were not widely available until 2007 with the introduction of the iPhone. And now we're facing the next surge of transformative technology, which is artificial intelligence. Let's begin by talking about making sure we understand what we're talking about. What is artificial intelligence? It's a branch of computer science that focuses on creating systems capable of performing tasks that we typically think of humans having to do, such as understanding language, perception, learning, reasoning, and problem solving. What's so special about AI? Well, no other comparable technology has existed in the past to think through problems, so each advancement relies solely on human intelligence, labor, and time. The pundits tell us that the AI revolution of the 21st century will be as transformative as the personal computer, the smartphone, and the internet. It will automate many mental tasks that may lead to significant job losses, particularly in industries that rely on routine and repetitive work, like ours, at least medicine in general. Its integration into everyday life will likely alter the way that people relate to each other and form relationships. Whether you think AI is going to end the world or save it, you have this man here to thank, Geoffrey Hinton. He's a British, I'm just curious, how many of you have heard of Geoffrey Hinton? Never heard of the guy. He's a British computer scientist who back in the 1970s simulated a neural network on a computer to study the human brain. His breakthrough came in the 1970s when he led a research group that achieved a dramatic breakthrough in which they could detect, they taught a neural network to detect items in an image. They could look at a picture and identify what the items were. That was 12 years ago. Now we have Google Lens. I don't know if you're familiar with that, but you can identify almost anything by taking a picture of it. There's lots of AI in our lives today. I use Google every day to search. We have it. AI makes recommendations for us. We use it in digital assistants. It helps us deposit checks on our smartphones. We see it in chatbots on websites, although we sometimes wonder how smart those are. I use Google Maps every day to avoid traffic. LinkedIn uses it to match our resumes with job openings, and we're starting to see it in healthcare and enhancing imaging, best practice alerts, that kind of thing, patient education even. And recently it's become available in smartphones. I don't know, I think you buy a new smartphone today and it's got Apple AI built into it. Samsung, the same thing. The impact of AI is to be just as profound on medicine as we're seeing it in everyday life. This is a busy slide, but an interesting one. There are over 1,000 FDA-approved medical devices with AI on the market right now. The first of them was approved in 2010 up here at the top. There were 108 approvals last year alone. This slide over here shows the year the device was released, the name of the device, what it's for, and the specialty it maps into over here. And as you can see, there's a lot of turquoise lines heading towards radiology because many of the devices are used to enhance images. So over half of the devices are used in radiology, and the next biggest group is in cardiology. I could only find 4 FDA-approved devices specific to orthopedics. One is called EKG, which is a pun on EKG, which is basically it's a gait lab in a suitcase. You take it out, shine the camera on a person, have them walk, and it analyzes their gait. The others here that are shown here are to enhance imaging. I have a question for you, I guess, at this point. How many of you are using AI in your practice now? And how are you doing that?
Note writing.
Note writing. And so it helps you write structured notes?
Yeah, so we basically go into a patient's room, click record after getting their consent, of course. And then at the very end, it compiles our notes.
Does your whole group do that?
We just started it.
Just started, okay. I saw some other hands.
I use it in research. I can put huge articles and do like a systematic review in like 5 minutes.
Yeah. How many of you are using ChatGPT? Yeah. Well, ChatGPT is a very powerful tool. We'll be talking a little bit about that during our presentation here today. It's helpful if you need to write something, oppose an appeal letter to a payer. It's marvelous at brainstorming. If you have a medical record that you need to simplify, it can be very useful in simplifying the jargon in that and making it into something that a patient can understand. And you can learn from it. It's very interesting to go out and have ChatGPT go out and explore a topic for you. I did that recently here. I was going to send out a Google Calendar invite to someone who was on Microsoft Outlook, and I didn't know how that would work, whether the two would be able to communicate with each other, so I asked ChatGPT that, and it went through the process of how the two calendars mesh together, and the answer that I got was spot on. Now you may be saying that's okay, but how smart really is it? So, after all, it's a general purpose large language model, and it isn't specifically trained to do any specific tasks. All that it's been exposed to is just a everything on the internet. It's read everything. It formulates an answer based on the vast amount of information that it's been exposed to, and so you kind of wonder how reliable is the answer you'll get. That question was posed by some orthopedists who asked it some questions about orthopedics, and they published that answer last year in the Journal of Bone and Joint Surgery. And the title of the article was Evaluating ChatGPT Performance on the Orthopedic In-Training Exam. Every November, orthopedists throughout the country get to take the in-training exam, orthopedic residents. And so what they ended up doing was they asked ChatGPT to take the OITE exam. It's a multiple choice exam that assesses their clinical reasoning, medical management, bioethics, and recall. And so they had they posed the questions to ChatGPT. The results were that ChatGPT got about 75% of the answers correct, similar to a fifth year or final year orthopedic resident, a man who's just finishing, or person who's just finishing the orthopedic residency. And that's better than the passing score for the American Board of Orthopedic Surgery written exam. This is a general purpose language model that can perform as well on that exam as a fifth year orthopedic resident. That's pretty mind-boggling. They concluded that ChatGPT performed better than an orthopedic resident in their final year of residency. And what's remarkable about this is that it achieved this task without being specifically trained for it. Again, this is just a general language model that's been exposed to a lot of material. Then there was this bombshell published last month in the Journal of JAMA Network. This is one of the journals published by the American Medical Association. 50 primary care and ER doctors were divided into two groups and given 6 clinical scenarios and asked to formulate differential diagnoses for them in 60 minutes. One group was given access to just ChatGPT as a tool to help it formulate the differential diagnoses, and the other was told to use the traditional tools, UpToDate, that kind of thing. Their answers were then graded by experts blinded as to where the answer came from, using a rubric that graded the clinical reasoning, differential diagnosis accuracy, and appropriateness of the supporting and opposing factors, and the next steps to evaluate the patient. They found there was no difference in the diagnostic accuracy that ChatGPT, and that ChatGPT was just as helpful to the doctors as UpToDate was. You could use ChatGPT to go out there and find just as good of material as UpToDate could provide. The bombshell incidental finding was that they fed the answers directly into ChatGPT, or not the answers to questions directly into ChatGPT, and told them to answer it without any kind of human coaching. And it did the best of all. So these are physicians in practice who've board certified, fully trained, and ChatGPT just outperformed them in a clinical scenario. And that was statistically significant. That was the only significant finding in the study. Let's talk about AI and payment authorization. You know, there's few things that doctors dislike more than having to get pre-authorization for surgeries. And that's because the system, as we currently know, is so strongly biased in favor of the insurers. So, you know, it's so bad now that many of the major medical insurance companies are facing class action lawsuits for allegedly using technology to deny claims and withdraw treatment to seriously ill patients. I ran across this article in the July New York Times on how people are now using AI to try to battle with the insurers to get pre-authorizations. The article talked about using Doximity GPT, which is a HIPAA-compliant AI tool that produces pre-authorization requests to insurers. And it provides detailed reasoning, supporting evidence, even draws on clinical guidelines and current clinical studies to support your need for surgery. And it does that in about 2 seconds. So that's the beauty of this. And I thought the striking thing that I read in the article was that the authors felt like pre-authorization could soon become an AI arms race of chatbots battling over insurance approvals. It may already be that way, and we just don't really understand it. On to the use of AI in clinical documentation. You talked about this, and I think this is going to be a very common use for AI in medicine. One thing all clinicians do is document their encounters, and we're all looking for easier and less time-consuming ways to do that, and AI is beginning to revolutionize that. I practiced at Southern California Permanente Medical Group. Our medical group had 6,000 physicians when I was there, and we did our own documentation and coding. We had no scribes. One of the most common causes of burnout in our group was the documentation requirements, particularly after we went live on our electronic health record. And our group has recently turned to AI to help relieve the burden of creating structured notes. And here's one physician's response praising that. The doctors in our group were given iPhones with ambient listening technology, and with the patient's consent, the phone listened in the background and provided draft clinical notes. And then the notes are reviewed and edited by the physician. And the technology provides structured notes for 50 specialties in 14 languages, and it's currently being used in 40 hospitals and 600 medical office buildings in Southern California. What is the software you're using?
So we've been trialing a software called Scribe-matic.
Scribe-matic. Our doctors liked it. They thought the tool shifted the balance of attention during a patient visit from being about 58% patient focused to 82%. So that's a big jump. Instead of being focused on what you're putting in the computer, there's a lot more attention you're able to direct towards the patient. And 67% of the patients reported the tool had greatly reduced the amount of time they spent in our electronic health record documenting outside of clinical hours. Our primary care doctors go home at night and spend hours on the computer documenting what they saw during the day. Simply cannot do it in real time. As I was preparing this talk, I used Google to gather some information, and lo and behold, Facebook showed up with this ad, which is, of course, directed towards me by AI. But it's for another clinical tool that you can use to document, similar to the tool that you're talking about here. This one's called Freed. The power of tools like this is that they can actually learn from you. As you edit the note, it learns what you like the note to say, and eventually begins to write notes like you would write them. Very powerful tool. AI is also being tested in prosthetics. That's shown here in the Utah bionic leg for above-knee amputees that is currently undergoing clinical trials. It's a lightweight, battery-operated prosthesis that apparently is controlled by AI using electromyography sensors. And it has active components in the knee and a compliant under-actuated mechanism in the foot and ankle. It took this guy with this prosthesis less than a half a second from his foot contacting here to be standing fully upright. The motion looked very natural. I play the video for you here now, but my computer with my old version of PowerPoint would crash. So we'll pass on that. But in passive mode, the device has the ability to walk indefinitely without being recharged. And there's similar work being done with in paraplegics and upper extremity amputees using AI and brain and spinal cord sensors. The study of AI in medicine is fairly recent, and this is a list of the publications that have occurred on this topic since 2005 through 2020. And as you can see, there's just been an exponential rise. Machine learning, which is what this particular graph shows, is a subset of artificial intelligence that involves training an algorithm to do a certain task. The algorithm has provided examples of what you're trying to do, and like us, it learns how to do the desired task through repetition, through trial and error. since many machine learning applications involve radiology and medicine, I'd like to jump into one of these example of that. And this is an example of an article that was published in 2002 in the Journal of Bone and Joint Surgery. And what they did here is you read from the title of the article, they were trying to detect sacral fractures on just plain X-rays using artificial intelligence. On the left here is an X-ray of a 77-year-old woman with a ground level fall, and on the right is a X-ray of a 20-year-old female who was involved in a motor vehicle accident. Both of them were suspected of having pelvic injuries. Does anybody see any fractures on those X-rays? Pretty hard to do. That's why they decided to study it using AI. So here's the CT scans of the same patients, and you can see some little cracks over here in the sacral ala on both sides, but you can't see them on the plain film, but you can on the CT scan. Of course, you can see the fracture through here in the younger person. In this study, the authors pointed out that sacral fractures are often difficult to diagnose on X-rays. And that's just because you have all this soft tissue overlying the sacrum and the bowel contents. So it's very cloudy. And so often clinicians use CT scans and MRI to improve the detection rate, but these are costly, and sometimes you can't do them on patients. So the authors hypothesized that the ability to detect sacral fractures on X-rays would be enhanced if they could use AI to analyze the images. So they gathered up over 2,000 patients, gathered up over the X-rays of over 2,000 patients suspected of having a pelvic fracture on X-ray. And these patients also had CT scans. They used the CT scans to label the X-rays so that when they fed the AI the images, they knew which ones actually had fractures. And the trained models were then tested on 200 test cases. And incidentally, they had 4 orthopedic surgeons also look at the same cases, the X-rays, to determine how accurate it would be. And then the surgeons' results were compared to the AI model results. Here are the results for the 4 orthopedic surgeons. You can see their various years of experience over here, ranging from 7 to 15. And over here, you can see their accuracy on the far right-hand side. And of course, it's right around 50%. Toss of a coin. Surgeon B over here, he did worse than toss of a coin. He's only 0.485% of the time. And of course, I guess, shockingly, not really, but the surgeon with the least experience did the best. 60% of the time he got it right. Here's how the AI performed. Over here's the name of the model that they trained. They trained 8 models here. And you can see the accuracy over here. The top 3 here had 90+%, were 90+% accurate on plain X-ray at detecting a sacral fracture just on X-ray without a CT scan. So that's pretty amazing, actually, to go from the toss of a coin to 90% on a plain X-ray just by having some software look at the X-ray. The authors concluded that AI has the ability to detect sacral fractures on X-ray, far surpassing that of orthopedic surgeons. And by enhancing the processing tasks that involve odds, AI has the potential to become a useful screening tool. A similar study was done on hip fractures. I don't know if you saw this, Todd, in the ER setting, where they had developed a software application to identify the fracture and classify it. And it had the same skill level as a fellowship-trained radiologist and orthopedist in detecting a fracture. And of course, that's a great thing for when you're on call, to be able to have some really skilled eyes look at an X-ray when there's often a question as to whether there really is a fracture. As there, we all know you get these calls in the middle of the night, and I can't really tell if it's broken or not. And yeah, this tool would revolutionize that, and it's coming our way.
Question.
Yes.
Did they look at whether or not that changed clinical outcomes, right? Meaning they looked at the imaging and then said, oh, we need to progress to CT or MRI or no, or if it like made any difference in terms of what advanced imaging you needed later?
That's really the next step, and they didn't talk about this in that article, but there's probably a trial going on somewhere right now where that's the very question that's being posed. So in summary, AI's impact on us is still developing, but it has great potential. I think the key applications for orthopedic surgeons include clinical documentation, imaging, and risk stratification. It'll also be helpful in predicting outcomes. There's been several articles on that recently. And eventually we'll have robotically assisted surgery that's done using AI, if we're not there now.
We're already there, so whenever you get a plan for like a total knee replacement or a hip, the software already knows what you usually do to adjust. When you first get the imaging to the plan that you like, it'll automatically follow kind of what you already done the best.
Are you seeing that in neurosurgery?
Not in robotics, not yet.
The Mazer robot. Or if you've heard about the Mazer robot that uses AI as well to place pedicle screws.
Yeah, the Mazer and there's Globus have robots to place pedicle screws, but it's not. They haven't made that sophistication to other than just accurately place a screw. I think what'll happen is they'll take a deformity case, analyze and plan all the screws, and then prepare rods that will match
The contour.
direction that's
Yeah,
needed.
how's it
That's
going?
going to be the critical step to get the robot to actually be super useful.
I'm sure it's coming. Yeah. I think current AI applications augment rather than replace physicians. It may be a while before we're replaced, but I'm sure eventually some of our functionality will, as humans in the medical setting, will be replaced by AI. There's my list of references, of course, created using AI. You can go out now on a website, click on the website, and it will go out there and harvest the information you need for a reference off of the website and store it. So, I mean, that was the first time I've ever used it for that, but there you go. Thank you for your attention. I also need to say goodbye. My wife and I are going to be heading to South Africa in January to volunteer with BYU Pathway. And we'll be helping set up a global education center over there. So I'll miss you guys while I'm gone. I'll be here till January, but that's kind of the plan for us. Thank you.